Ever pushed a patient harder, convinced that more reps would fix them, only to have them come back flared up? I've been there. It took me 30 years to learn that sometimes the smartest physio move isn't doing more, it's knowing when to back off. That's the 80-20 rule nobody teaches in physio. Most patients need to be pushed, but some need you to pull them back from doing too much. In this video, I'll share the 3 skills that can help your daily practice. How to spot who needs what, how to build confidence instead of fear, and how to recommend rest without feeling like you're doing nothing. And there's a twist. The 80-20 rule doesn't just apply to your patients, it applies to your career survival too. That's the bonus section, so don't just skip ahead. So if you've ever wondered if you should be pushing your patient harder or easing back on their program, then this one's for you. Major idea number 1, the 80-20 physio rule, avoiders versus endurers. Don't just push everyone. One of the trickiest parts of our job is knowing when to push a patient forward and when to pull them back. That uncertainty can weigh on you because the last thing you want to do is make someone worse. And if you've ever finished a patient visit second guessing yourself, just know I've done that more times than I can count. Trust me, it gets easier. Let's be honest, you also don't want to look like you're doing nothing for your patients, so here's the golden nugget. Being able to spot which camp they're in is the quickest way to get to results. The biggest mistake is to fall into the one-size-fits-all, more is better mindset, thinking every patient just needs more squats, more stretches, more of everything. That's not how it works in the real physio world. You've got to recognize the difference between avoiders and endurers. These are 2 types that come from a model that explains how people often respond to pain in unhelpful ways, either by avoiding motion or by pushing through too much pain. Picture 2 patients. On one is hesitant, super long pauses between exercises, 2 reps and they say they're done, they wince, they stop, they give up. On the other hand, the patient is charging ahead, doing more reps than they were asked, doing their own exercises, inventing stuff in the clinics, they wince, they grin, they push through it. One avoids, one endures. Both are stuck, but in different ways. Your job is to spot the pattern and tailor your plan for that patient in front of you. The avoiders need movement, the endurers need permission to pause. In practice, avoiders make up about 80% of your caseload. They're the sedentary, deconditioned, they're convinced that movement is dangerous. Sometimes their mindset has been poisoned by things like they read online or other well-meaning people have talked to them. On the other side, you've got the endurers. This is the 20% who live by the no pain, no gain motto. They push into pain, they flirt with overuse injuries, and they ride that roller coaster of flare-ups and setbacks. These folks don't need more exercise handouts, they need permission to rest, to slow down, and to let their tissues adapt. So if you're still not sure which type of patient you have, just ask. Simple questions like, when your pain shows up, do you tend to stop right away or do you push through it? Or how do you usually decide on whether it's time to rest versus keep going? These questions will tell you a lot. Their answers will tell you if they're scared to move or they just keep pushing themselves too hard. And once you know that, you can tailor your approach. That's when you can actually make a difference. You're not just treating their pain, you're rewiring how they think about it. And that's huge. That's effective. And that's rewiring is starting to build their confidence because spotting the type is just the first step. Major idea number 2, confidence over exercise, the physio lesson nobody taught you. Most patients don't care about the perfect diagnosis or some textbook explanation. They really want is to get back to feeling normal again, and they get back to the stuff they care about. More than anything, they need their confidence back. Fear of movement is the silent barrier. Movement apprehension, guarding, is often the biggest unspoken limit to their recovery, and if you don't tackle it, no amount of rehab will help. Their recovery is derailed before it even gets going. That's why I'm always banging on about active treatments being better than passive ones, like I explained in this video up here. The trap is a lot of physios fall into is complicated biomechanical jargon or worse, using catastrophizing language that often makes the patient feel fragile or even broken. Throwing out terms like a unstable spine or a slipped disc, ouch, that's not helping anybody. One time I had this 40-something-year-old office worker who tweaked his back playing football on the weekend. His doctor told him his x-rays looked like he had an 80-year-old spine. So when he got referred to physio, he shuffled into my clinic, stiff as a board, guarding his back, moving like a robot. But then once he realized his back wasn't really broken, wasn't fragile, he relaxed, and within a month he was moving like himself again, including weekends back in the park. So don't freak your patient out by telling them they're broken. Even if they have multiple fractures and an unclear prognosis, reframe it. Give them some glimmer of hope. The shift you need to make is simple. Use your words to build confidence, not fragility. You're not a magic hands fixer or a machine will cure everything kind of guy. You're a guide, a coach, someone who helps people trust their bodies and move again without fear. One of your most powerful tools isn't some machine or some manual technique, it's a conversation. It's the hurt versus harm conversation. Use it early, repeat it often. Teach patients that discomfort doesn't automatically mean danger and damage. Pain's often just your brain hitting the panic button when it doesn't know what to do. Once they understand that, you can help them slowly get back to movements that they've been avoiding, starting with the easy ones that feel safe and building up from there. Each little win knocks the fear down a peg and builds them back up again. And if you ever feel like you're not doing enough, remember this. Helping someone take one step with more confidence is worth 10 exercises that they don't believe in because they ain't doing them at home. Active exercise is the real driver of recovery. It's the stuff that they do on their own. That's the cat's pajamas. That's what happens between the visits, the home exercises, and your patient's daily effort. That's the cake. Anything you do in the clinic, like the manual therapy or the modalities, that's just the icing on top. Coaching confidence is key. Focus on active, patient-driven progress. This creates lasting results. Confidence helps patients thrive. When pushing activity, the right amount is crucial because some patients don't need to be pushed, they need to be pulled back. Major idea number 3, when rest is the best PT advice. Coaching smarter, not harder. Sometimes in physio, the smartest move you can make is to tell patients to do less, not more. There's a small but important group of people who push themselves too hard, and the best intervention for them is counterintuitive. It's convincing them to slow down and change the way they're doing things. Reframe doing less, not as failure, but focusing on what matters, or cross-training, while those tissues rest and reset. For these endurers, it's the 80-20 in action, where cutting back is smart strategy. A super common trap that is projecting our own exercise bias onto the patients. So if you're a strength and conditioning kind of guy, you might assume that everyone needs deadlifts or something like that. If you're a yoga guy, then you see yoga solutions. So take a pause and see it from the patient's point of view. What do they need for their functional recovery? The real shift here is to coach patients to take ownership of their recovery and help them move smarter, not harder. That's what makes progress sustainable. I remember working in a sports medicine clinic, and every September we'd get flooded with runners with knee pain, all hammering the miles to prep for the October marathon. They thought the answer was to push harder, add more miles, and push through the pain like it's a badge of honor. But the real fix was the opposite. It was giving them permission to rest, mix in some cross-training, add some balance and mobility, and build a smarter ramp up so they could actually make it to race day. For these endurers, the right physio advice is to do less. They need explicit permission to rest strategically, and it's essential to explain that resting isn't weakness. It's a smart way to recover without overdoing it and crashing later. Telling them to back off wasn't wasting their time. You're coaching them through this critical phase. It's about finding the right balance. Sometimes that means pushing them to do more, and sometimes that means pulling back to do less. This balance this is key to delivering care that truly supports the patient goals. Effective care is being guided by function, helping patients achieve what's meaningful to them in their lives, like shopping independently or navigating stairs safely. When you focus on function, respect recovery, and coach smarter movements, you give patients a sustainable plan. And when patients thrive, it's time to apply the 80-20 principle to yourself, because burnout waits for nobody. Bonus section, the 80-20 secret to survive and thrive in your physio career. The 80-20 rule doesn't just apply to your patients, it applies to you and your career too. Everyone worries about making clinical mistakes, imposter syndrome, or burning out from being overloaded, but you're not alone. The key is to know when to invest your energy so that you can get the biggest return for both you and your patients. Think of it this way, devote 80% of your focus onto the foundations, building trusts, educating patients, and empowering them with self-management strategies. That's where most of the real progress happens. The other 20% can go towards the refinements, fine-tuning the exercise details, learning fancy pants, manual techniques, or trying some advanced special tests. The real success isn't about chasing a perfect 0 out of 10 pain score. It's about seeing patients return to the life that they love, confident that they can manage their own body and function without holding your hand every step of the way. That's the win. And while you're at it, let go of the superhero complex. You're not a magic fixer. You don't need to be. Your real job is to coach and to restore confidence and stay focused on improving your patient's function. I learned this the hard way back when I was working as in an outpatient clinic. I'd spend ages obsessing over a perfect exercise program, but the breakthrough moments didn't come from the exercise tweaks. They came when I slowed down. I listened properly, and I helped patients believe that they can actually handle their own recovery. That's where the real progress stuck. You don't have to be perfect. You just have to keep showing up, putting your heart into it. When you work this way, you not only help your patients thrive, you give yourself a boost too. And that's what worked for me. It might just work for you too. It's the lesson I wish somebody had told me sooner. So here's the takeaway. Great physios don't just hand out exercises. They know when to push the 80% who are stuck in fear and when to pull back the 20% who are grinding themselves into the ground. That's the real 80-20 skill that nobody teaches you. Push most of your patients to overcome their fear of movement, pull some of your patients back from doing too much, and keep the focus on function instead of chasing flashy, quick fixes. If this video gave you some insights into your patients, drop a comment below. You're doing great. Keep going. Your patients are lucky to have you. Even on those tough days, you're making a difference. And if you want more straight talking physio advice without the fluff, well, that's why I'm here. My 2 books are now available at Amazon. What They Don't Teach You About Documentation in Physiotherapy School, a short how-to manual for successful daily note templates, and From Injury to Recovery Through Exercise, simple functional exercise progressions for physiotherapists to restore lifting, standing, walking. Thank you for your support. Let's have fun watching this neat video together. And by subscribing, you'll be among the first to know when new exciting content arrives. Thank you.